Welcome to the Strong Enough podcast, where we talk about the challenges and celebrate the triumphs of people from all walks of life. I'm your host, Claudia, and this is your co-host, Jen. Today, we have a super exciting return guest, and we're going to talk about a subject that is often considered taboo, but we're ready to bring it out into the light. We're going to talk about sexual health and the musculoskeletal system and how different things like trauma and medical issues can affect your sexual health. Please help us welcome Ingrid Harm-Ernandes. Ingrid, how are you today?
Doing great. Thank you so much for having me on. I'm really excited about our conversation that we're going to have and hope it really helps a lot of people out.
I know that it will. And obviously, we've been chatting a little bit before we hit the record button. And, what we're going to talk about today is something that is a little bit taboo for a lot of people, whether that's from a cultural standpoint, a religious standpoint, just an embarrassment standpoint. So we're just going to put it out there, though. Today, we're going to talk about sex. We're talking about sex. See, we can say it without laughing. There's nothing funny about it. There's nothing embarrassing. Sex is fine. And we're going to talk about some of the reasons and some of the solutions, but some of the reasons that people, particularly women, have issues with sex, and whether that's severe pain, pelvic floor dysfunction, things that are inhibiting their ability to engage in sex comfortably, I'll say. So Ingrid, I know you and I know you're wonderful. Jen knows you. Jen knows you're wonderful. But for anybody who missed your first episode and hasn't seen how wonderful you are, will you please tell them a little bit about yourself and why we picked you to have this conversation?
Yeah, so I am a physical therapist. Been a physical therapist for about 40 years, but I've been a pelvic PT for almost 30 years. And when I started, everybody thought I was kind of nuts. Nobody really thought the musculoskeletal system had anything to do with pelvic conditions. So when I would go to a doctor's office and say, I can help your patients, they'd be like, yeah, I don't know. You have lobsters crawling out of your ears, right? But once they started sending patients, they realized how much good we could do with it. So my long path over those years is going from a completely unknown kind of field to having to do a lot of research on my own. I'll date myself a little bit and say I had to go to the library to figure out what incontinence was. And that was simply because some of my pregnant patients were like, what? I'm leaking. What is this? And they confided in me, which I was so honored. And all through my career, I've been honored that people share very important, intimate, embarrassing things they don't want to talk to anybody else. They've shared them with me. And I feel that I've been so lucky to help people over the years. And I've moved from just clinical work to educational work now. So that means that I have taken hopefully everything I've learned, not just from books, but from my patients, from my colleagues, and try to give that back. So now I spend a lot of time educating communities and medical and, whether it's nurses, doctors, PAs, you name it, everybody around in the field so that I can get everybody on the same page with what the musculoskeletal system is, how that's involved in pelvic floor conditions, and then how can people get help? Like, you're not alone. And that's what I say all the time. I mean, the first opening comment in my book is you're not alone, because I don't want people to feel like they're the only ones that have this. It's rare. Nobody can get help for it. I just have to live with it. And what are women told through their life when you're pregnant? Oh, live with the pain. You've given birth, live with the incontinence. You go through menopause. Oh, live with the pain with sex. It's all part of, being a woman I just don't want to hear those comments anymore. I feel like it stops people from getting help. So my main goal now is that education. That's why I'm so thrilled about, talking about these topics with you, is because I just feel we need to change the narrative. We really need to change people from thinking they can't get help and they should be embarrassed to talk about it. No, these are, like you said, we can talk about sex. That's okay. This is part of our lives. And we need to address when we're not having the sex that we want, we're not having comfortable sex, we're not enjoying it. It's okay to talk about it. It's okay to get help for it. And so thank you so much for, letting this topic get out there.
So I'm in that camp kind of that you mentioned, because I know for me growing up, and I mean, I had parents who were involved and, would talk to me about health and sex and all those things. But still, I was one of those people who thought, oh, being like doubled over in pain during your period, that's normal, right? Or, oh, it really hurts, after I have sex with my husband, but that's normal, right? And so I didn't even think to bring it up for the longest time, because I guess just socially, or I don't even know where it comes from. Where either of you, where do you think that comes from, like in our society, that we just don't talk about it?
Yeah, I think it's a long history of many things, which is why I think it's not so easy just to like bridge that gap and to change the barriers, because everything pelvic related is, especially when I started, was it's down there. There's like belly button down. We don't really talk about that, and it's not okay to talk about it, and there are taboos associated with it, and or we don't see it. So it can be as simple as we don't see it, and when we don't see it, we don't think about it, right? It's we have to take a mirror to look at ourselves. It's not external. It's not easy to see. So I think there's all these different barriers, and as women, I think we're protective, right? And yes, that can be fine, but the protection can be brought to too far. You know what I'm saying? So like, I wish I had an easy answer for that, but I think everything from cultural to religious to societal, to how you've grown up and your experiences, things that you've had as a youth and as an adult, and, abuse and all these there. I could go on and on. So I think it's very, very complex. It's also I would say tied to anxiety and depression and all these other things too that affect how we think about it and how we address it. So for each individual, what my comment would be is each individual, we kind of have to think on our own what's in our life that might be preventing us from talking about it. And who can we open up to? Who do we feel comfortable with? Or to say, wait a minute, although I thought it wasn't okay, I do need to address this and I do need to talk to someone. And that could be clergy, that could be medical. It doesn't matter. It could be a friend, a loved one. It really doesn't matter. Whoever you feel like I can open up to is that first step to breaking the barrier, right? No matter what it is. So I think the good news is we can do that. We just have to find our own path to doing that.
I feel like we are making baby steps.
Yeah.
And what I mean by that is, we as a society decided to address men's sexual function issues, with medication. And we have Crohn's disease that is getting a lot more visibility, I'll say, because of medication. So is that why you feel like those issues are getting the attention? Is it driven by the almighty dollar? And that's why we're seeing those things more?
I think that's part of it. Absolutely. It's, someone who's got the loudest voice or the backing or the money or whatever it is, they often they're the squeaky wheel, right? And if women are told this is normal and you should live with it, they're not even going to be the squeaky wheel, that needs that attention. So I think that there's this, again, a large, large picture going on there. Some of it is women were considered a protected group, in research. So women weren't even like the big part of research trials into the late 1990s. We're not talking that long ago. And it's still like only changing now. So in the case of medication, I'd give an example. What they did is the primary participants in a study would be men, and then they extrapolated that information out to women, but that doesn't work because we're a different size, we're a different muscle mass, we're a different hormone, we're up level. I could go on and on how many differences there are. So it's very unfortunate that a lot of research was not even on women to say this is how we can help women, right? So again, it's multi-level, and it's very unfortunate. And I love it that women are standing up more. I think what we have to do is we have to, as all age groups, as women, we have to be a little bit better of supporting each other, because I see a lot right now of like, oh, only the millennials are stepping forward, only Gen, X is standing forward. And and I'm like, no, you do realize that your baby boomers have been screaming about it, but nobody listened, was the different story, right? And we stand on the shoulders of the generations before. So I'm grateful to those people who were pioneers before me. And I'm hoping that people after me say, oh, I'm going to use your platform, I'm going to use your voice to get us forward more. So I do want to reach out to everybody and say, let's work together across the generations, and not say one generation's doing this and the other didn't do anything. I know that's a little sidebar, but I think if we stand together, all generations, we have a louder voice and we can get more done.
I mean, that's just unity. I mean,
Yes.
and it's funny because we've been talking about that at church. We're in this series that's called Fuel, and the U is unity, and it's talking about maybe not necessarily being united, and being the same, but being united as a people to come together as a common cause for a greater purpose. And I think that's what that reminded me of. What you just said is like, it's kind of to take it the same context is, like, again, women who either, whether they've had abuse in their past or whether, they have medical conditions, like these things also just need to be, I think, more talked about, just it's taboo right now. Well, things are taboo because you don't talk about them. So once you start talking about them, they won't be so taboo. And I think because it's sexual health, it's, yeah, quote unquote, kind of taboo to talk about, but also the associations too between, either some types of chronic diseases or some types of traumas or some types of, abuse, like that all also gets tied into that. And I think that's one of the marks that we're missing is that doctors, and I'll say this as a patient, a Crohn's patient, dealing with my own medical team, and my medical team is amazing. I'll be honest with you. I go to one of the top hospitals in the nation, but they're very silo focused. It's, oh, this is just digestive. And I was like, do you not think that the rash that's on my entire body right now has something to do with my messed up digestive system? And so like, I think that's the thing is that we became like, we went from being doctors, like general doctors, back in the olden age where it was just one doctor that performed everything. And then we started getting these specializations, which I think is amazing because we do need that. But it's almost like we went so far over here with the specialization that now nobody looks at the whole entire body as a whole. And I say whole, that means physical, emotional, spiritual, like mental, all of that goes together. And I think that's what we're missing is the mark is everybody just operates, oh, well, this symptom right here, let's fix this symptom. Well, what was the root cause? And so like maybe your mental health thing actually stemmed from, it could have been an injury or something, your body's still like trapped or something. I don't know. But that's kind of where I feel is that it just needs to be brought back together, like in looking at it as a whole functioning unit, because that's what the human body is. Like there's multiple systems that have to work together in order to make us function well.
Right, right. I 100% agree, which is why I am always talking about the interdisciplinary care model, that we have to reach out to others. We can't possibly treat someone just from our own little lens. Yes, we're specialized there, but we are a whole body, like you said. It's not just my pelvic floor. So when I treat patients, it's not their pelvic floor that I'm treating them, but my specialty starts at the pelvic floor and then grows outward, right? Where I treat, and we talked about this a little last time, is how the body's so integrated and the pelvic floor is just one part of the core, and the core is very different than most people think, right? So I 100% agree with that. And we really, really need to go with this interdisciplinary care model.
I also agree. And I think it also ties into something that we talked about, well, a lot recently, is just women supporting one another. Because you mentioned, talking to perhaps a trusted friend or whatever, a parent. And we've talked a lot about women in general have just been taught to compete against one another. We can't support one another because we're fighting for the same thing. And I want to bring an end to that, and say we don't have to fight. There's enough good to go around. There's enough success to go around. There's enough pretty to go around, funny, athletic. There's enough all of those things to go around. And so we need to work together instead of bumping heads all the time and trying to figure out how we can top one another. But I think that also takes, a group of women who are strong, confident, comfortable in their skin, secure, or secure, as I like to say it, to allow that. Okay, so we've hopped on a soapbox for a moment. We're going to hop back down. Let's talk about, from your perspective and from your expertise, what are some of the things that people might not think about that can cause sexual health issues?
Yeah, so from my perspective, I think one of the hardest things is to get people to understand that our pelvic floor and our core, as I mentioned before, is indeed all part of a musculoskeletal system. And what I mean by that, it's comprised of muscles, ligaments, fascia, tendons, the whole nine yards connected to our lovely skeletal system. And it's how we operate and function and move and are able to do things mobility wise every single day. What's interesting is people can understand, oh, my biceps, is a muscle and I can do this, but they don't understand that their pelvic floor is this wonderful, I call it a sling or a hammock, if you can imagine, right? That is at the bottom of our pelvis and it holds up all our organs all through our life. And the interesting thing about that is it has so many functions. So it's got the supportive function. It's got a stabilization function where it works with our core. It's got a sexual function, very important. Sphincteric means it holds back our urine and our fecal matter or our poop. When we don't want to do that, we can control it. When we do, we can control it. So that's all part of it. It's got a birthing function. It's got a breathing function. Every breath we take, the pelvic floor operates with our diaphragm. So it's this beautiful structure that does a lot of work, but it just doesn't get thought about. We think of organs, we think of hormones, and that's what gets treated, and it's easy to give a pill for. Musculoskeletal system's a whole nother world, and the musculoskeletal system, so when we talk a little bit more about sex, it has to do with being able to enjoy sex and to be able to even have sex to begin with, right? And it's the broad spectrum. So if we cannot tolerate, if we talk about vaginal penetration as an example, if we cannot tolerate a finger or a penis or anything else, then those muscles most likely are getting tight. We're not just talking about a skin issue, which unfortunately in the light of everybody talking about estrogen, it's like, oh, just put estrogen on it and you'll be fine. Well, if it's the muscles, probably not, right? So we have to realize that I guess the best way I can describe it is our musculature is set that the vaginal muscles, so the muscles of the pelvic floor, but around the vagina can actually contract and relax also. It's so if they start to get tight, then if we try to put anything in there, and that could be anything from an ultrasound wand, a tampon, a finger, it doesn't matter. Those tissues are going to be so tight that something cannot enter. If that's the case, then that's painful. And the brain says, the last time I had sex, that was pretty painful. And I don't know if I want to do that again. And you're not consciously thinking that, but your body is. So the next time it's tighter and it's more painful, and eventually gets to the point where someone cannot have that penetrative sex, right? So, if we look at that over time and this protective mechanism that our pelvic floor provides gets us to the point where we can't tolerate sex, but we start blaming it on, well, it's just estrogen, or it's dry tissue, or it's just a mental health issue, or you know what I'm saying? It's always something else, but it's not the musculature. The problem with that is if it's not treated, you can try all the other things and it won't get better. And the person starts blaming themselves for not being able to have sex. Relationships get affected. I'm very sad to say that I had many, many women walking through my door who had pain with sex, or they came in for incontinence and never talked about sex with anybody, and their relationship was ready to end. Right. So it's this whole thing that affects our whole life. If we go back to that whole life perspective, right? Even though I treat the pelvic floor, I would send patients to sex therapists, mental health therapists, if they needed an OBGYN or a urogynecologist, whatever it was, would reach out to my team to help all the other components while I worked on the musculoskeletal system. And then if I take it one step further, I mentioned the core before, since our pelvic floor is so intimately connected with our entire body, our hip and buttock muscles or abdominal muscles, I would often have to treat all these other components too. So I'd have to treat the abdominal area or the back. I can't tell you how many patients had hip and back problems that I had to work on in order to bring the pelvic floor around, right? So when someone comes in with some of these different sexual issues I'll talk about that can stem from many different things, I have to address all of that to get them better. And if we can get all those different components better, they're so successful, and they're so amazed that they can go back to enjoying their life. Not just, I'm going to have sex, but I can enjoy it. I can be with my partner. I can do what I was doing before. Or if my goal is to have a baby, I can have a baby. I just recently told this story to a group that I was talking to, that one of my favorite stories that's in the book is basically that I had a patient who came in who was having pain with sex. She couldn't have sex at all. She was recently married. Their goal was to have a baby. She also had back pain. And so I said, let's work on everything. So about 3 months later, she did great. I discharged her. And about 3 months after that, I was finishing up doing some notes at the computer, and the receptionist came back and said, Ingrid, one of your former patients is in the lobby and she just wants to talk to you quick. I'm like, okay. And I get ready to bring her back, because I don't want to have this conversation out in the middle of the waiting room and all. But I step in the door and she's standing there with her husband behind her. And he has a huge orchid in his hands. And before I can say, come on back, she goes, Ingrid, thank you so much for getting me pregnant. Well, this was an orthopedic setting and the room was silent. And we just start laughing. And I say, you're welcome. But to me, it meant so much that in this room full of people, she was just willing to say something like that. And she had grown from being so embarrassed and so worried about it, and totally transformed and changed and, achieved her goal. It was just a wonderful thing. So, that's what gives me the strength to keep going, to keep saying, we need to address the whole system. We need to address the musculoskeletal system and really transform people's lives that way.
I just want to say, I can't even tell you how many tubes of estrogen have been thrown my way by doctors.
Yeah, that's
bathroom right now, and it sits there because at this point I know it's not going to help, but it is like the first go-to. It's like, oh, pain with sex, rub this on there, and I'm like, it's not the problem. It's not the problem.
No, and when we're talking people who have other conditions going on at the same time, that's a red flag to say, wait a minute, even if the musculoskeletal system wasn't the problem in the beginning, if we've got multitudes of problems going on and we have pain going on, the musculoskeletal system responds to it and then becomes a problem as well. So that's what I'm saying. Like, we have to look at all of it. And when we're talking about the interdisciplinary care, if someone recognizes, oh, like you said, Crohn's disease or other issues that are going on, maybe we need to address the musculoskeletal system as well, because it's become involved in all this and takes a life of its own on.
Let's talk a little bit about trauma. I don't want to talk about trauma, but when people have experienced some type of sexual trauma, abuse, or an assault in their life, a lot of times they do then have issues with sexual relations and sexual health going forward. Will you talk about the body aspect of that? So aside from the emotional and mental component of why that might be difficult, But will you talk about why it can become difficult from the musculoskeletal point of view?
That is a great question because there are a couple things that happen. So one, when someone has gone through trauma, we often hear about the parasympathetic and the sympathetic system. And basically our sympathetic system, everybody talks about fight and flight, right? That idea that either we're going to have to fight a predator off or we're going to have to run away from it. But there's a third component to that, and it's a freeze component. So there's really three F's there, but the freeze component rarely gets talked about. And this is someone who's shut down, completely. And it's not necessarily something you see out like obvious. That's, oh yeah, this is what's going on. It takes a while. So for me, what happens is this is all musculoskeletal or affected, or it affects, I should say, the musculoskeletal system, because our flight, fright, or freeze is all, you can see what I'm doing with my fists, with my arms, with my shoulders, right? So someone who's chronically in this state, it means that their musculature is always in that ready to go. So we should be able to relax our muscles. We should be able to tense them, but we shouldn't be in a constant state of tension, which happens with these folks. But what we don't know is at the pelvic floor, that is happening as well. And again, we don't see it. So we talked early on, we aren't aware of our pelvic floor. So I wouldn't walk around with my arm like this all day because I'm stressed, right? I would say, oh, that's kind of embarrassing. I'm not going to do that. Maybe I'll do a little with my shoulders, but I'm not going to do it with my arm. But guess what's happening at the pelvic floor 24/7? This, right? So there's this constant tension that occurs. So someone who's been through some sort of abuse anywhere through their life, most likely is having something like that happen. And that's what I'm saying. It may not be musculoskeletal to begin with. I call it an accumulation of life. We have one thing after another happen over a lifetime. It could be abuse. It could be surgery. It could be an injury. It could just be, constant emotional upheaval that creates this. And then over time, our pelvic floor is just always in that tension. And I'll do a quick sidebar. It's why a physical therapist, if you hear a pelvic PT say, yeah, pelvic floor exercises might be good for someone, but it might be the wrong thing for someone. If someone's always in tension, we might have to teach them how to let their pelvic floor go before we teach them to strengthen it. And it's this very fine line of how do we do that? So a pelvic physical therapist, what they do is they'll assess it, figure it out, and then say, okay, this is where we need to start. So I get so frustrated when I hear like, oh, a machine will do this. And I'm like, no, we need to reasonably say this is what the pelvic floor can do. And this is what we need to do to get back to your goals, to your life, to what you want to do, not everybody out there, right? So it can't be a one size fits all. So it's when we go through trauma, we have to be very aware of that as well, because what it means is that person's experiences are different than the next person walking in the door. And I have to figure out their experiences and how we will address it before we can do it. So I may do an internal assessment with someone, but if another person has I don't know if I'm ready for that, we don't necessarily do that assessment. We wait, we do other things that are very beneficial and determine according to the patient's wants, abilities, needs, and then we do those things. But we always try to get them at that right point where we're doing the right thing for their pelvic floor for them.
I love what you just said because I have been to the pelvic floor therapists who want to, I'm just going to say this, dive right in, and it sucks. As someone who has experienced all the things, trauma and chronic illness and everything else, like that's the last thing I want, is to meet somebody and then have them there. And especially because I already know it's painful and it's not going to go well. So for me, that's something that I now know to ask or look for if I'm going to do pelvic floor physical therapy. What are some other things that people could look for, and whether you want to give like red flags or green flags, but when they're looking for a good musculoskeletal / pelvic floor physical therapist, what are some yays or nays that they can be on the lookout for as they're choosing that person?
Yeah, you definitely want someone who's experienced in the manual therapy, as we call it. That means hands-on kind of therapy, who is understanding also about how the whole system's integrated, right? So usually that's a therapist that's a little more, experienced. Not to say that someone new out can't be doing that, but you don't want someone who says, "Well, I just specialize in incontinence," let's say, right? You really want someone who specializes in the pain aspect of things, because the pain is where you really start to differentiate with what can I do, who can do this, who can tolerate this, who wants to do that, and begin to formulate your program based on what that patient's experiences is. One thing I would say is, if that physical therapist spends, 20, 25, half an hour, 30 minutes with you just discussing your case before they ever start, that's a great green flag. You want someone who spends that time with you to discuss your history. So I always asked, let's say if someone came in for incontinence, I still asked about their sexual history, because it's really important to understand, is the incontinence just an incontinence thing on its own, or something else? I asked about bowel history. What's going on with the bowels? I can't tell you how many people, they came in for, let's say, prolapse or pelvic pain, and they had bowel issues that we needed to absolutely resolve in order to resolve the other issues, right? So this therapist should be asking you about all your body systems, I'll call it. That's another green flag. A red flag is, I'm going to talk to you 5 minutes and we're just going to go do an internal exam, and they don't say to you. So I would take my little old model that I have sitting here behind me, and I would pull the model out and I would say, this is what's happening in your body. These are how the muscles are affecting your system. This is what else is happening within the organs. And so we want to figure this out. And one way we do it is an internal exam. And in doing the internal exam, I'm going to do this, 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 and this. If you're okay with it, then we can proceed. If you're not comfortable, we can wait. We don't have to do it. That therapist should be saying that to you. If they're not saying it to you, then I would encourage people to say, hey, I'm not comfortable doing that right now. If the response is, oh, cool, that's great, we don't have to do it, okay. If the response is, no, we really need to do it, then it's kind of like, okay, but thank you, I don't want to continue any further. Like, I know that's hard. I know that's hard when you walk in, but please, please, that is so important. When you go to a doctor's office and they want to do an exam, you should be able to say to them, I need to take a couple diaphragmatic breaths before we start. I do have pain. Do you have the smallest speculum available? Do you have to use a speculum? I know I'm asking a lot for people to do that, but particularly people who have an abuse history are often not the first person to say no. So I was always telling my patients, if they had an abuse history, you're in the driver's seat, you say no to me. And that changes the game 100%, right? So these are little things to look for that are positives. Again, I'll say in my book, I have an entire chapter on how we assess, and I have an entire chapter on how we treat in there, besides the musculoskeletal system. So you're learning A to Z, and then how to take care of yourself. So basically what I do is, if you go to have an assessment, this is what you should be experiencing, and this is what's okay, and this is what's not okay, right? So it really gives you a foundation to know, hey, I've got someone here that really does understand me and will set up a program for me as an individual.
I love that.
Mhm.
And I hope people hear that. And if you have to write down notes before you go, write it on your hand so that you can, remember it, or take a trusted person with you to kind of speak for you. You've mentioned the book a couple times. I've mentioned the book a couple times. Jen's probably mentioned the book a couple times. Let's talk about the book. And I feel like book giveaway.
Yeah,
Book
absolutely.
giveaway.
I think we should do a book giveaway.
So we're going to do a book giveaway. So people will let you know how that's going to happen. But Ingrid, tell us about the book and tell us why you decided to write it and what kind of impact that it's had.
Yeah. So the book is called The Musculoskeletal Mystery: How to Solve Your Pelvic Floor Symptoms. And a mystery because of everything we just talked about. People don't know what's going on down there. So in clinic, I used to always say, hey, we're going to talk about the musculoskeletal mystery. And they're like, what? So it would open the conversation up, I think, and get people realizing that nobody really talks about it, and it's okay for us to talk about it. One of the main reasons I wrote the book is it was taking patients 5, 10, 20, and 30 years to walk through my door. And it was because the patients themselves didn't know what to ask for. No one taught them. And B, the physicians, nurses, PAs didn't know about it either, which to me in this day and age is still astounding and very aggravating to me that, I'll still talk to groups and they're like, Ingrid, I had no idea. I didn't know this even existed. And that's really frustrating. Or I kind of knew about it, but I had no idea what you guys do. So the book was my way to communicate with everybody. So it's written such that patients, their loved ones, lay people, they can all understand this. Doctors, nurses, PAs, mental health therapists. I've done webinars for mental health, dentistry, you name it, to make the connections. So what happens is everybody's on the same page. Everybody talks the same language and nobody's afraid to talk about it. All right. So I feel like if I could accomplish that, then this is something that will change the scope of how we treat the pelvic floor, how we understand the pelvic floor, and we can get patients care much sooner, better care, sooner care. That was my, if you want to call it a passion, that was my passion to really get that out there and find that I love treating one-on-one and educating one-on-one, but I felt like it wasn't enough. It just wasn't enough. So I love talking to people. I love talking to groups. I've done book clubs. I've done, you name it, just to get people's minds to open up. And the comments usually like, you just blew my mind. After I discussed the whole thing there, you blew my mind. I've had nurses come up. I teach a musculoskeletal assessment course for nurses and doctors so they understand how to do a comfortable, informed consent musculoskeletal assessment. And they come up to me. I just did one a couple months ago, and the nurse said to me, I've been a nurse practitioner in this field, urogynecology, for 25 years, and I had no idea you could do this. I had no idea we could discover this. I had no idea how to communicate and really get this point across. So if I need to refer to physical therapy, I know exactly the patient that should go and why, right? And that was eye-opening. After doing this for years and years and having these comments, it's still eye-opening that someone long time within the profession, this isn't newbie, still did not understand all those connections. And I can't blame them. The education isn't there. That's the fault. And the problem is the education isn't there. It's not the people. They want to. They are thirsting for this knowledge. My workshops booked out. Like as soon as this conference opens up, the workshops booked out before they even finish booking the conference because all of them want to learn more about it, right? So it's just so important to get this information out. And the book, I think, gives me the ability to bridge the gap and to talk to everybody. And it also allows like a patient to take that book, lightweight, large font, take the book, bring it into the doctor and say, this is me. And I'd like to get help for it. It legitimizes the conversation and makes it that these conditions are common, but they're not normal. And I really have to get people to say that because if people feel it's normal, they don't get treatment for it. We want to normalize the conversation. We want to make sure everybody's okay with talking about it, but we don't want to say it's a normal condition.
Right.
I love that. If people don't win the book in our book giveaway, where can they find the book?
So it's at a company called Desert Harvest and on Amazon. So just desertharvest.com and under their what do you want to call it? Supplies items. You can find it there. And then I know people love Amazon, so it is on Amazon as well.
Amazon is one of my guilty pleasures. I have to admit, it's that same day delivery for me.
Yeah.
But quick side note, I used to live in Breckenridge, which is a tiny mountain town. We didn't get same day anything in Breckenridge. Even like one day delivery was like 2 to 4 days. So when I moved to Denver and could then experience same day delivery, guys, game changer. Not necessarily in a good way.
No more target runs.
Yeah, no more target runs. But anyway, before we let you go, we are gonna shift topics real quick. And I do want to say, clearly you're gonna have to come back because we only got to scratch the surface on sex, and we have much more to say on it and sexual health. But we're going to switch topics real quick, and we're going to talk about one of our favorite topics, which is tattoos. I have a lot of tattoos, as we all know. Jen has a lot of tattoos, not as many as me, but that's fine.
But like surface area though, like I got one that's like really, really, really big too. So
I mean, true.
yeah.
So okay, that's fair. Ingrid, maybe not in the tattoo club, which is fine. What do you want to know today? What do you want to ask her? Ask her a good old tattoo question.
Ooh.
I think I remember your answer from the last one.
All right. When you were a teenager,
Okay.
did you ever think about getting a tattoo? And or like what was it?
I have to say, as a teenager, I did not. So I know that's interesting, but I'm first generation, and my parents owned a bakery, and I worked since I mean, seriously worked since I was 12 years old in my parents' bakery, and I saw the hard work my parents put in. It was kind of like, I want to save my every dollar. I don't want to go through something that changes, my body in that way. It's kind of interesting. So my thought process was more, I want to make sure that I've got a comfortable nest egg. I know my parents, they came to the United States with $60 in a suitcase, and started their lives over.
Where did they come
From Germany.
Nice.
Yeah, so it was a very terrible time for Germans to come over to the United States as well, in New York, in a population that really was very rough on them and rough on me as well. And it was, a lot of people don't realize kind of the environment I grew up in, and it gave me a very tough skin. I'm a very small person, and I was tiny, 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 as a child. So tiny that my mother was afraid I could not get on up the bus step when I started kindergarten. But she stepped back and she said, I'm going to let her try it on her own. And I remember it because I can see I had to put my both hands up for the railing, and I literally had to pull myself up with my arms to get my leg up and step on the bus. So like that memory is solidified. And my mother later on told me she wanted so much to help give me a boost. And she said, no, I wanted to learn to be independent. She's little, and she's in a tough environment. And so she's going to have to learn to take care of herself. Right. And so it was interesting that my mother told me this much later, but I remember saying to myself, you're going to do this. So my mindset is more of this just very hardworking, get things done. And I guess, I don't know if tattoos seem frivolous to me. I'm not sure what the mindset was. I don't know, but my mind wasn't going that direction. If I thought about a tattoo, and I think it might be similar to what I said last time, but the change is that right now, about a year ago, I was able to do my first art show. And art is another passion of mine, and gardening is yet another little love of mine. So what I did is I combined my love of my pelvic health work that I do and my gardening and my artwork all in one. And I do pelvises of all different directions and positions with the flowers from my garden in it.
Yeah.
And so if I had to have a tattoo, I think in respect and response to my profession, it would be over my sacrum, and it would be a pelvis with flowers in it.
What flowers?
So when I did it, my flowers that I grow are mostly like black-eyed Susans, echinacea. They all have a meaning. Orchids have a meaning. I think it would be an orchid within the pelvis, because there are tons of meanings, many actually meanings for that. And I just think it would be representative of kind of my life to do that.
I love it.
That's great.
Okay.
I love it. Yeah,
Yeah.
absolutely.
All right. Ingrid, where can people find you? So if they want to learn more about you or the musculoskeletal mystery, if they want to come take a gardening class with you, where can they find you?
So I am on LinkedIn and I'm on Instagram. Some Facebook, but I would say LinkedIn and Instagram is my best places to be. LinkedIn in particular is a lot of like really good information about pelvic conditions, and it's a little bit more, you know, not
Professional.
sciencey, but yeah, it's
I like it.
Like vertically and like, so, yes.
yes, yeah.
Love it.
A little
Yeah.
more schooling.
Right. I wish I were really good. I wish I could take my creative part and do like the videos and all that for Instagram, but I'm a little too routine. I spend a lot of my time doing my courses and doing the work on that. So I don't think I've quite the bandwidth to get over that and do I need someone to kind of kick me in the butt and say, "Hey, Ingrid, let's do some videos."
Okay, so for now, if you want the sciencey kind of nerdy stuff, go to LinkedIn. If you want probably flowers and art, check out Instagram. Ingrid, you've been absolutely amazing yet again. We hope that you'll come back very soon so that we can continue this really important conversation. Thank you so much for being here and for sharing so much that will be really helpful for people when it comes to sexual health and their musculoskeletal system. Thank you so much.
Thank you for having me, and thank you for all you do and getting this information out to people. I'm so grateful that you do this. It's awesome.
Thank you for listening to the Strong Enough podcast. You can find us on your favorite podcast platform by searching Strong Enough. Don't forget to follow us on Instagram and Facebook at Strong Enough Pod. If you have suggestions for an upcoming episode or a future guest, please reach out at strongenoughpod@gmail.com. Remember, you are worth it.